Well, good afternoon, everybody. We're going to get to a start here. This last session, we're going to talk about California. And having lived in California for 11 years, I get to make some jokes about California. This panel is going to describe some experiences from California, which I think will probably reveal both how California can be a leader in showing maybe the rest of the country some things that work and also maybe some things that don't work. And we have three panelists who have, I believe, worked together in various ways as well as separately. But they've all worked to improve mental health services in the University of California system as well as other colleges and universities in California. And they're going to be talking about what they've learned about advocacy for student mental health services. And I wanted to just note that one thing they probably won't talk so much about in terms of advocacy is the importance of personal qualities in an advocate. But having now met all three of them and having known Temina and Vic for a little bit of time, I can tell you that I think a lot of what makes them effective is their personal qualities. And I actually met Temina when she was a postdoc at Berkeley when she was a grad student at Berkeley 6 years ago, and I was a postdoc. And she came to me because I was doing a postdoc in mental health services to see if I had any ideas for some work she was planning on improving services for graduate student mental health. And at the time, I didn't really have any useful ideas, as far as I can remember, for her. But maybe now I do, because just talking to her and seeing her good ideas and her passion for what she was doing is what got me started being interested in college mental health, and what led me to find out about this conference here for the first time. And Vic Ojakian, last year he attended the conference for not the first time, but I met him after the conference briefly, and he mentioned an idea which I think planted the seed for this year's theme, which he mentioned the basic idea of doing a conference on advocacy. And he presented it in such a compelling way. So I think right there, just in that small way, you can see the personal quality. And Jeff Prince, although I just met him, you can see in your booklet his long record of leadership in college mental health. And I think it's clear that to go that long in that many leadership positions requires remarkable personal qualities. So the format's going to be similar to the panel earlier this morning. They're each going to spend about 10 to 15 minutes presenting their experiences, their thoughts, and then we're going to have questions and answers and discussions. So I encourage you to submit questions either at the microphone or on the note card. So we'll start with Vic Ojakian.
Let's see, can everybody hear me okay? Yeah, good. A couple of quick housekeeping things before I get into more of the details of my talk. First thing, I want to thank the conference organizers and Dr. Eisenberg for inviting me, and especially because of what he just said. This conference is important to me more for the theme of the conference than for somebody like me to get up in front of a microphone and speak. Second thing I'm going to say, though she hates this, is my wife Mary, who's out there, and she'll raise her hand. My wife Mary is with me, and we have partnered basically in working in the area of mental health with transition-age youth, which are 15 to 24-year-olds in California, and with a focus on California colleges. Sitting up in front of where I was sitting, you can see a bunch of reports. Since 2006 in California, the following's been done, some of which Mary and I have had involvement with, some of which we haven't. The UC system, the University of California system, has formulated a task force very much like what Dr. Lewis talked about Emory College earlier. They formed a task force, produced a report. They have an implementation plan, and they're working on improving college mental health services on each of the 10 campuses. Not sitting up here is a task force that was just authorized on January 28th of this year by the Chancellor of the California State University System to review and analyze and see what improvements need to be made in the 23 campuses mental health services. Also up here is a brief report from a group of California community colleges. The psychological service providers formed an association a couple of years ago now, and in conjunction with that, the statewide California community college systems hired a mental health service ombudsperson to review what's going on with the 112 campuses that they have. And then also up here is a report that I had nothing to do with, but thank the authors of, a report by Stanford University that came out in October of last year. And finally, there's a report up here, the thickest one on the end. It's an analysis that was done by a third party hired by the Santa Clara County Mental Health Director to review the mental health status of students in all 33 districts in that county. If you're not familiar with that county, it's more known to the general public as Silicon Valley. So the point would be this to start off with, and that is what you're seeing is a wide spectrum of analysis that's going on through systems, college or otherwise, that are looking at the mental health services of their area. And so I'll leave you with this remark at the beginning before I get into the substance of what I was going to say. If we've done that with such a wide spectrum of schools, then there isn't a college in this country that can't do the same thing. Now, every now and then I'll break off, and it's partly because I was asked what motivates me to do this. And what motivates me is the fact that I lost a son to suicide. And if you look in your handouts, in your packet that you were given, there's a handout that I put together, and it covers sort of the slides on page 2 cover some basic information, and it's information that most of the people in here I'm sure know about, so I'll say it quickly. Why focus? Maybe that's my son talking to me. Why focus on college student mental health per se? And the reason is, besides my personal situation, what we know is that suicide is the second leading cause of death amongst college students, and I put the brief data in here, that we know there's a high correlation between suicide and mental health, that we know that a lot of mental breaks in terms of serious mental illnesses occur during the college age years, and that we also know that few people, not enough, and we've heard this during the conference, don't get diagnosed or treated. And that in fact, in many ways, the college campuses do a far better job than the general community mental health service does in working with young adults in the area of mental health. So for us, we've heard a lot of people talk about use the word safety net. What we're trying to do is actually build one. Or if you take a look, as we have, there's a lot of holes in what some people describe as a safety net. So we're either trying to patch it, or we're trying to create strands, strand by strand, to make sure that the safety net is a safe place. So let me talk quickly about strategies. How do you get to the point that you're doing something like what we've done to get your institution or a body institutions to do something? And there is a way of doing that. So I heard Dr. Graydon twice now in an earlier conference that I came to, and today again, talk about the fact that we know what the problem is, and we know what some of the means are for solutions, but we don't seem to be doing anything about that or not pushing it. Well, that's what I'm going to talk about. So there is a way of pushing it. And basically what you do, or I'll describe what we've done, that is that you go out and you have a game plan first. What's going on with the college system and how are they operating? And you understand what the current environment is in as granular a detail as you can. Parallel to that, what you do is and this will sound crass maybe to some, you develop a database and you network with people. And who is in that database? Well, it's everybody and anybody that you know over here, all your friends, neighbors, and whoever. And then over here, it's those people who have some ability to change what's going on in the community. So that might be an elected official. It might be some of the mental health providers in your area. It might be some of the national organizations that have fostered good work and are probably in a lot of the communities of the people who are out here. Groups like the National Alliance for Mental Illness. It's your faith-based groups in your community, and it's any other community or civic leader that you can think of and that you know. What you then do is or what we've done, and there's 2 or 3 different ways of doing this, you contact the decision-making body over your individual college or your college system. And most of them, especially if they're public schools, will have an open meeting. And you'll let them know that you're going to come and speak with them. If you do this right, you put together a packet of information and you send it to them. And simultaneously, you ask a group of your decision makers, you explain to them why this is an important matter, and you ask them to send supporting letters on your behalf. And I won't get into some of the people who have done that for us, but in a most recent situation, we had letters from 2 national organizations, 2 statewide California organizations, a couple of regional organizations, some leaders in the education community in the state, several elected officials, local, regional, and state, including in the case of one, the person who holds the budget strings over the operation that we're going to talk to. So some different ways you can approach a body, and I'll tell you 3 that we've done. One is that, we set the groundwork, as I mentioned, and then when we showed up at the meeting, I presented a list of questions as a request using in California, but I'm sure several of you have this in your states, what's called the Public Records Act. Basically what I'm saying is I demanded information that's required to be provided to me under the law. The second way you can do that is you can, prep the group, like I said, and send them, have these notes and letters come in from people, and then go in and explain to them that you've reviewed the system and what you think some of the shortcomings are, or things that are missing on some of the campuses. And the third way of doing it, which sort of involves the first 2, and this is something I don't think people do enough in the mental health community, you can go in and address a body, and Mary and I have done this, where you look at a group of 50 people. They don't know you and you don't know them. And the thing that you point out to them is that you know that several of those folks' lives have been, it's always interesting doing this, their lives have been impacted by mental health, either directly or indirectly. Normally what happens when we do that is that we have to listen afterwards, and I don't mean this in the wrong way. We have a group of people who come up to us and explain to us what's going on in their personal lives. And frankly, it's very hard to listen to. So let's see if we can get back to being a little serious. But in the case of one body, it was both the chair and the vice chair of that group who had to explain to us some of the things that they've had to deal with over a long period of time. So that's essentially what you do. You make a request, and then you try and get folks to move ahead with it. What we found, Dr. Eisenberg, in the questions that he gave us beforehand, said, well, what have we failed at? Mary looked at that and said, looked me in the eye and said, we haven't failed at anything. And frankly, we haven't. Because by God, would you like to deal with me? It would be a very difficult thing to do. So we've asked folks to follow up with us. In the case of all 3 college systems, that's happened. What we've then done is follow up with them to make sure that they're moving a project ahead the way that it should move ahead. And all of that to date has happened. Where you tend to fail, and where we failed in a few localized things, is where you have a limited number of decision makers, a small body, and maybe a single individual trying to make a decision. For whatever reason, those folks are highly possessive of what they have and are less likely to want people involved in what they're doing. And you have to spend a lot more time working with them than you would with a larger body, to be honest with you. Let me quickly peek. Do I still have a few more minutes? Okay. Dr. Eisenberg asked in his question something about what parents can do. And I imagine there's a group of parents out here, even if you're in this from a professional end, who have students at college. Okay. Here's what I learned, or what Mary and I have both learned, that I think that you should do. And the first thing I'll do is I'll keep it at a high level. I think as a parent, don't forget you always have to be vigilant, and you have to make sure that you stay informed about things. So you need to create a good line of communication with your child who's a student. But this is one that's not in the literature too much. You need to get a good line of communication with their friends and their contacts, because there's going to be times you can't get a hold of your child and you're not sure what's going on, but in fact, you can call their friends and in a non-intrusive way, try and see what is happening. You need to be understanding, and this audience doesn't need to be, follow what the warning signs are. When we talk to a lot of groups, and I think this has been brought up at the conference, and it's one of the things the Depression Center is good at, is that the general public is very poorly educated in the areas of warning signs. And we have done a lousy job of basically educating our parents and adults in what in the area of first aid is just taken for granted. You need to be proactive with your college, though there's this whole concept now about helicopter parents and them being too active. There's a certain level of reasonableness that I think you can ask people at a college and find out about how things are going, and you particularly need to focus in on what the mental health services are for that college. And in your handout, I give you a list of who knows how many criteria. It's probably 30 criteria that I've used in looking at the various California colleges to determine whether they're doing their job right or not doing it right. And then in some of these, I pulled out a Dr. Caddison and DiGeronimo's book, dealing with College of the Overwhelmed. They have a chapter on this. They brought up a point that I hadn't thought about before, and that is you should have your own crisis plan in place so that you know what you're going to do under what set of circumstances as a parent to respond to things. So let me get into this last section, because in fact I think in many ways it's the most important section. There was a question asked of us about how do you sustain these sorts of things that are going on if you can get improvements made in a college mental health service program. And the two things I'd say about that, or let me preface before I say two things. First of all, I can't rely on one or two individuals. I think there are some people in the California system now that probably think Mary and I are capable of doing a lot of things, but in fact, our focus has always been not on us. It's to do two things that I think are very important, and they've come up at this conference, interestingly enough. They pop up here and there. One is you need to institutionalize what's going on when you can get your mental health service on a college campus analyzed, reviewed, evaluated, and you know what needs to be done, and that work started. You need to make sure that that goes on through time. And there's some ways of doing it, and one is you can put in an oversight or get an oversight committee put in. And so that committee will be there regardless of who's in it to take a look at these things. You need to educate your faculty and staff, which has come up a lot. They need to be involved and consider this a primary matter. The fact of the matter is that what we've learned is most of them do consider it a primary matter, but because we haven't made it a visible primary matter, it hasn't gotten the vocal backing that it always should. So it should be, and this is happening, by the way, with several California campuses in all three layers that I mentioned. that in fact there are people who have elevated mental health up there in the same category with any of the other primary things that a university should do. And I'll say this to you without making it sound negative. Nobody can tell me that there isn't a school in this room that can't do the same. Because I'm talking about 3 different layers of colleges, 3 different compositions or styles, organizations of colleges. It can be done. It just takes people who want to push it. There are several other things, but I think I'll just name 3 others quickly. Need to involve your student body. Students know what's going on, I think, better than most. And it's come out clearly in several things that we've done, and it's come out very clearly in something recently, and maybe we can get into that in the Q&A. But a college campus is only part of a community. And that's why today I've asked the questions a couple of times of other speakers. How are you tied back to your community? We need to have this so that when you're operating together, you'll see the main thing that'll happen is this, that nobody can drop the ball then. You're highly visible. And then you also need to do another thing that I know a lot of people don't like, and that is you need to work with your local media and make sure that you are one with them. So I personally keep a list of media people who are up and down the state of California. And frankly, part of the way I got that list is those folks called me up or they've talked with me and pointed out the mental health issues that have gone on in their own families. Now, part of the reason I've spoken a lot at a lot of things, and part of the reason why I don't restrain myself, by the way, is I think that is part of our issue. Folks, we need to take this. How can I say this? We need to be far more passionate about this issue than most people are. So I hear people talk about student suicides like it's some sort of nondescript factor, when in fact lives have been severely impacted. In the handout, I give you some ideas for funding, and hopefully I'm doing okay time-wise. And frankly, I think a lot of these can apply to anybody who's in this room, even though a lot of people will have doubts about that. Some of the funding ideas, I just treat it in a lot of ways like a business, and it's in here in slide 11. So I said colleges need to look at first their cost efficiencies. We talk a lot about we need more money to do certain things, but there are certain things that can be done far cheaper. So one of the things that we recommended, now we're talking about a college system, so I understand it's not an individual college, but we question things like why do they have 11 different or 10 different websites? Why are some of them good and some of them bad? Why isn't there an individual at the statewide level, statewide office, president's office, developing a single website that can be adaptable and adjustable by people for their individual campus needs? You know, we talk about the fact, and I'm sure a lot of you have this, brochures on your campuses. Why are people buying those as individual universities? Why aren't you joining together and getting some sort of a volume discount? A volume discount, frankly, on anything you can get a volume discount on. We identify free resources for people, and we've done this a lot, and we particularly do this for the community colleges because we know their budgets are far less. But we provide a list, and anybody can find these. There are plenty of videos out there that are available. How many people have gone into YouTube and typed in suicide prevention? We got one. Well, Mary, don't raise your hand. There's a couple of people, 2, 3 of you. Go do that and see what you find. What you're going to find is 40 or so videos that are free, that are basically put out by some of the major groups in this country. Anybody can do that. It doesn't cost anything. And what you can do, and I've asked a group of community colleges to do this, is evaluate them. Tell me which one's the best and which one's the worst and why, so we can communicate that information to anybody else. So there's several other things that are out there that are online and websites, and I'm sure you know about that. In the area of funding, I know that a lot of people are familiar with the Garrett Lee Smith Memorial Act under SAMHSA, which is a funding source, and that's something that anybody should look into. I also know that Thomas Wood Johnson Foundation has given out individual grants, and several people probably know about that. So let me give you two other ideas that are less known. How many people out here have checked in your state, like I've done in the state of California, and seen what grant programs are available only to in-state operations? I love doing this when Dr. Gruden raised his hand. Mary didn't this time. You ought to do that. California has a few. I haven't advertised them to people. Jeff will probably ask me afterwards, what am I talking about? But, I've done some research on that to keep that as a funding source in my back pocket for people who don't have money. You need to do that and see what else is out there. And then the other thing I'll suggest, because we were talking about this before I started to speak, a lot of times I hear campuses, and I've heard it from a few of you, talk about, well, you're just one little individual campus, or you're small campus, or you can't do this and you can't do that. There's a simple concept in politics, I guess in life, and that is there's power in numbers. So there are some things that you need to look at that maybe if you can't do it individually, you want to see if you can do it jointly. So I was explaining to my fellow panelists up here that a group led by what I think is just a wonderful individual has gotten together 10 California community colleges. They're spread throughout the state, and they put together a joint grant proposal. It's to do the same thing, which is QPR, which has been brought up at this conference by one speaker, but they're doing it with numbers, not saying, well, I can't do this, or my administration won't let me do that, or who am I, or I don't have enough time. No, they figured out that there are ways of doing things that don't always need you thinking that you're out there by yourself. So let me leave you with the final thought and a punchline, and that is, Mary and I have always said that our goal is very simple, and it's not what I think some people probably think it is. We're not looking for fame, that's for sure. We're not looking for fortune, because we pay our own way to everything that we do, regardless of if funds are available or not. What we're looking to do is to save lives. It's that simple. We're trying to reduce the pain in some folks' lives. So in the slide set, on the last slide that's in there, we leave our email address. Now, why would two individuals who've already spread their names way too far across the state of 38 million people do that? That's because, how can I say this? We've got high expectations in the people who are out in this room. What we want you to do is to go back and do what we've done, even as much as it hurts to still talk about this because of the personal pain that we've gone through. Our goal is to make sure that nobody else is in this situation. We call it an exclusive club. It's one of the few things in our lives that I'd say we practice discrimination over. So again, the punchline is this. You don't have to remember me or necessarily the specific words that I've just said. You've got a handout that leads you to do some of the things I talked about. Now it's really up to you to go do what we've already tried to do in a state that's frankly far larger than most in this room, meaning it's a doable task. Just put a little bit of energy and a lot of conviction behind it. And so thank you for your time.
I think I speak for everyone in this room when I say that we're grateful and inspired by Vic and Mary Thank you.
Thank you, Daniel.
Our next panelist is Temina Madon.
Thank you very much. I would also like to thank the organizers of the conference, Daniel Eisenberg, Trish Meyer, and all of you for being here. My experience in suicide prevention is also personal. When I was in graduate school, I lost my partner, my boyfriend. That was now 6 years ago, almost to the day. And I think it does drive a lot of us. It doesn't have to be the sole driver, but it does drive a lot of us. After my partner died, I was told that his death was sort of falling through the cracks. He tried to get help at the University Health Services, got referred out, didn't make the right connection. And I thought to myself, the system must be pretty leaky if he fell through the cracks. He was really bright, really driven, entrepreneurial. And it sort of inspired in me a drive to find out what happened and see if we could change the system a little bit. So what I found after talking with the head of health services on the campus was that the campus was going through budget cuts. And as we were going through budget cuts and health services were being cut, we also had an increase in enrollments. And this was due to California's demographics. There were more and more college-age children, and they needed to enroll in the state system. So as we all know, there's an economic crisis now. They happen at intervals, and we're used to that. But the problem is that a lot of times when budgets get cut, social services, health services, community services are considered fungible, not necessarily the thing to preserve. We don't think of them as core infrastructure. And so our solution at the University of California, Berkeley, where I was a graduate student, was to try to tie funding in our college and on our campus to actual enrollment. Regardless of budget cuts, regardless of increases in enrollment, we needed to tie the funding to the actual number of students on the campus. So as we get more students, if students are, for example, paying a fee per student, we have enough income per student to deliver the services they need. So I'm going to talk a little bit about what we did at Berkeley, specifically to change the way healthcare was funded on campus, so that healthcare and prevention services were tied to the number of students. What we did was to instigate a student fee campaign on our campus and in fact throughout the University of California system. Any increase in student fees requires a vote of students on the campus. It's very democratic, and if students feel that it's worth their funding to support a student activity, they may vote to support a fee. As you can imagine, the average college student is not aware of mental health services on the campus. They're also often not aware of the risks of mental health problems, either in themselves or in their friends and colleagues. So we had to tie some health promotion and awareness building into this fee campaign to let students know that a healthy mind and a healthy body are essential for academic success. A lot of the students, as you know, are very driven. They want to succeed. Many of them want to go on to graduate school. In fact, UC Berkeley for a long time has been the leader in sending its undergraduates on to graduate school programs. So we decided to hold a student fee campaign and vote. The way we structured it is very similar to the community health centers model. Community health centers were sort of an innovation in national policy in the 1960s. It was based on legislation to create community-based, government-funded health centers in low-income communities to make sure that even if there weren't private providers in communities, people could have access to health services and they didn't have to rely just on the market. So the community health centers model usually builds in a community board of healthcare users who define the needs for the health center and help to drive which services will be funded by the federal government. So we did something very much like that. We got students involved in the student fee campaign, had them identify some of the services that they felt were missing. Among those were mental health services, and got them involved in the health fee campaign. Some of the pros of this model are that you increase the spread of knowledge about the health fee and about health services using peer-to-peer networks, which, as it turns out, in many contexts are very effective for spreading information. You use existing networks rather than funding very expensive campaigns that sometimes don't reach everyone. You also empower health service users to get involved in the maintenance of their own health by involving them in the campaign. And it also builds some accountability. If you build student involvement into the fee itself, you're building a pool of people who are going to hold the campus accountable for meeting their needs. So I will cut the story a little bit short, but say that we were successful in raising an additional $1 million per year in student health fees through this campaign. Every year the fee is reviewed by a student group, a student advisory board, and the fee has continued at about the same level adjusted for inflation, and it provides services for students that are linked to the number of students on the campus. This is going to happen regardless of whether or not there are budget cuts. I'm almost certain that in this economic crisis, budgets will be cut on the campus, and frankly, social services won't be exempt. You have to keep faculty member salaries in place and staff member salaries, and I understand that. But this is a way to really protect students' access to very essential services. And as Vic said, we're talking about 18 to 24 or 26-year-olds on college campuses, the people who are most vulnerable for mental illness. So in parallel to the student fee campaign, we also did some other things at UC Berkeley, more on the advocacy side, although I very much think that the fee campaign was an advocacy effort as well. We had to make the case to the administration, and particularly the people who hold the purse strings. In our case, it was the executive vice chancellor and provost on the Berkeley campus, that ignoring mental health problems amongst students actually causes more problems for them in the long run. You lose productivity of your graduate student instructors, your TAs. You lose productivity in your laboratories or in your research groups when students are depressed and not functioning. Students' quality of life is decreased, and of course that's perhaps the most important. But there are also misuses of resources when students don't get preventive care and instead need post-injury care. What we realized in speaking with administrators is that we needed data to demonstrate the problems. Sometimes anecdotes are important. In fact, they almost always are. But when talking about budgets, I think you also really need data. So we conducted a survey of graduate students at UC Berkeley. Daniel played a role in this as well, in helping to design the survey. And we ended up getting response from 3,000 of the 9,000 graduate students at UC Berkeley when we asked about their incidence of depression or self-reported perception of depression, their use of campus mental health services. What we found is that you really need hard facts to focus resources where you'll think they'll have an impact. The survey was important because it did give us information that we could hand off, but it also increased graduate student awareness. As I said, we had 3,000 students taking a survey asking about their experiences. We shared results with media. There still is media coverage of this study that we did. It was one of the first ever looking at graduate student mental health. We shared it with the leadership on campus, with our faculty members through the Academic Senate, and of course with the Health Services Center. I think what's important about doing these surveys that are large and sort of blanket the population is that you're able to identify perceived problems across the entire student body. It's not just focus groups, which are also important, but being able to speak for a very broad swath of the campus can be very valuable. And again, we also use student researchers. 2 students who were doing their PhDs in the School of Public Health in Health Services Policy and Analysis, Jenny Hyun and Brian Quinn, led the study, and we got graduate student government funds to support it. So the outcome of this sort of parallel process of data collection and analysis and dissemination is that multiple other UC campuses have now implemented the survey and collected their own data on graduate student mental health. Other college campuses have contacted us to use and adapt the survey that we used. We've had, as you've heard from Vic, action at the state level, UC-wide study of mental health on the campuses of the system. As I mentioned, we've had ongoing press coverage. We had academic publications in mental health journals. And I think you could say that these outcomes have been sustainable. We continue to speak with people on other campuses about the work. I see on campus, I'm now staff at UC Berkeley, I see a lot of the advocacy materials and awareness building materials that were developed back in 2004 and 2005 when we were working on all of this. I guess some of the problems or failures, I would say, and I'll just speak very briefly, even with advocacy to increase funding and awareness, my question is, do we really know what works to prevent suicide? And do we know how to change college students or grade school students' perceptions and understanding of suicide prevention? I would argue not. There have not been a lot of rigorous scientific studies to study suicide prevention. And I was listening to one of the panels just before this, and the speaker was saying that we're sort of 25 years behind the alcohol and drug use community in terms of the research and knowing what works to prevent the deaths of adolescents. So in addition to all of the advocacy to increase services and funding for services and awareness, I would say that advocacy is needed on the National Institutes of Health and the Centers for Disease Control and all of the research funding agencies at the national level to really push for rigorous studies so that we can learn what works and then implement things that are very evidence-based. Thank you.
Thank you. Thank you, Temina. Our next panelist is Jeff Prince.
Well, good afternoon. Thanks, Dan and Trish and the committee for inviting me, and thank all of you for coming to the last session of the conference so late in the day instead of hitting the road early. I really appreciate your being here. After listening to my two colleagues speak, it's just very touching, and I almost want to throw away what I'm prepared to say and just react. But I do want to say that these two individuals you heard from are very modest. Their role, actually, in creating what became a major funding source for all the University of California colleges was critical. Without both of them, I really don't believe we'd be in the position we are today with almost double staffing at every counseling center in the UC system. So the first time I've said it publicly, thank you. They've also taught me an important lesson, and that is how important it is for us as counseling center directors, and I'm the counseling center director at Berkeley, to really build alliances with student leaders and with parents. We have so much to learn, and I've learned a lot, but more importantly, individuals who are parents and who are students can advocate for resources in ways that counseling center directors cannot. When I go to an administrator and ask for money, it looks very self-serving. When students speak up and say, we want this service, they listen. When parents speak up and say, we want this for our children, they listen. That's been an important lesson in advocacy for me. We were asked actually to address 4 different questions. And the first was, what motivated you to do this? And in my role as a counseling center director, it's probably obvious what would motivate any counseling center director to try to increase resources, but more importantly, to do it in a system-wide manner. Some of you may be in colleges that are parts of systems like UC is. Some of you may be at smaller colleges. What we're talking about is what came together from 10 colleges in the UC system. For those of you who aren't familiar with it, there are 10. We're talking all about Berkeley, it seems. But Berkeley, of course, we think of as the flagship of the Cal. It's Cal, for those of you who follow sports and don't understand that's Berkeley. There's also some others, and I wrote them down in alphabetical order, not to show preference. There's Davis, Irvine, LA, Merced, Riverside, San Diego, San Francisco, Santa Barbara, and Santa Cruz. And they vary a lot. Several of them are 35,000 students. A couple of them are just a couple of thousand students. So in looking at how we got a system to come together from very different kinds of cultures and at the same time create some consistency across them and provide resources is an incredible job to do. And not very many systems nationwide have actually tried to do this. So I think it is important to have this panel to say, well, what worked? And advocacy was a critical part of it, and yet advocacy is something we often don't talk about. So what motivated me as a counseling center director was just looking at my job and looking at my staff and looking at what was going on, which is the same as what's going on at every campus. And we saw increasing numbers of students coming in the door. Over the last number of years, it's increased 70%. We saw a huge increase in the severity of students. The number of students hospitalized over the last few years has increased 79%. So we were dealing with long wait lists for students to come in. We were referring out large numbers of students after briefly seeing them. We were decreasing the outreach we were doing on campus because we were attending to all the students coming in the door. We were raising fees for students. They had to pay for sessions. And we had a huge turnover in staff because they didn't want to work for these low wages and for this kind of job. It was a miserable situation, and it's one that's familiar, I think, to most people, although I'm painting it maybe a little blacker than it looks, perhaps. So it was not just a moral issue that we needed to do something, but for the university it became a financial issue and a legal issue as well, because there are a lot of risks involved when you don't have a staff to address the demand that's there. So what actions did I take, and what actions did the other counseling center directors take? Because I wasn't alone. There are 10 directors in the system. I happened to be chair of the group of directors during the time that the system-wide efforts went into action. But there were 10 of us, or at that point 9 of us, because there's a new campus, working on this. And the actions we took I'll divide into 3 different categories. One is organizational actions, one is consciousness raising, and the third was establishing some new structures. And all of these were guided by the idea that we wanted to have the system pay attention to the whole 10 campuses and to give us more resources. We also needed to look both at our individual campus politics and our individual campus needs. At the same time, we were looking at system-wide needs and balancing both, because one affects the other. As a system, we look to each other for benchmarking. And as a system, we're much more powerful as a group of 10 and a voice to the Office of the President. In the system of California, the head is called the President, not the Chancellor. The Chancellor is a head of each campus, so the reverse of some other places. So the first group of actions we took were organizational. We got together and we decided we would put together a document that would actually identify what are the core services that a counseling center on a campus needs to provide. And we made sure those core services included outreach and prevention activities, not just clinical services, which is what many of us were shrinking into being. That document then became approved by the Office of the President and filed away somewhere, but became a good reference for what is it that the University of California agreed to as the minimal core services for each campus for counseling. And it also became a nice template for our strategic planning. When money did become available, where were the gaps and where did we need to move next? The second organizational thing we did is we made a strong connection with our attorney for mental health out of the Office of the President. This is the attorney that would help every one of the 10 campuses with legal issues as they came up around mental health concerns, like subpoenas or risk factors. That was important because by bringing a lawyer into our group, and we would meet with him 3 or 4 times a year, he would come to each of our campuses twice a year, he would get to know our work. He could be a voice to the president of the university about the liability and the risk for not having enough staff. The third thing we did is create a database, and that's been referred to by the earlier 2 speakers. And we needed to collect data across all of our campuses to show how disparate the staffing was, the demand, the levels of service, and what the trends were. So that not one campus could be pointed to like, oh, that's Berkeley, the kind of student that goes to Berkeley. Well, we can dismiss that. No, we have 10 campuses showing trends. And it's much more powerful than national data because it's immediate. The last organizational thing we did is we decided that we needed an organizational link to the Office of the President directly. The Office of the President is this office in Oakland. It's a 5 or 10-story building with administrative offices. And they connect with each of the campuses in a variety of ways, but they never connected with mental health directly or counseling centers. So we sought out an advocate in the President's office who would meet with us when we met biannually. or even more often, so that she would get to know what our issues were. We had a contact in the Office of the President who could advocate for us there. So developing those organizational structures, I think, was the first and probably took up a lot of time. And I have to say, this effort took many years. We started prior to Virginia Tech, so it wasn't a reaction to an event. It really grew out of the need that we were having. The second group of actions we took were, I'd say, consciousness raising awareness of people of what is going on. What is our role in helping the campus understand the academic impact of mental health problems on the academic environment, and making sure that the key stakeholders on campus understood and would support us, we hoped. In many ways, we borrowed from the Air Force model, which you've heard about in a number of presentations through this conference, which is this is a community problem, and therefore it takes a community solution. It's no longer something you can shuffle off to the counseling service and say, take care of it. It's your problem to resolve. It's something we need to look at in the fabric of the university, of the campus, of what we're doing, what we're not doing that contributes to mental health problems and that helps resolve them. On the campus level, the consciousness raising took the form of basically, I would go and do a dog and pony show to anybody who would listen, or I could present data on what we're seeing in students. The rise in acuity, the number of students with problems, the lack of resources. And so, for example, I would go to the academic senate committees. I'd go to deans and chairs committees, academic faculty meetings. I would make sure the topic got on the chancellor's cabinet, student government meetings, graduate student meetings, talking with student and staff newspapers. We created on our campus, to raise this visibility, a day-long workshop on students in crisis, funded by the graduate division and the undergraduate division, where we invited faculty and administrators and key student service personnel, and a whole day of informing them of what the crisis was that's going on, because so much of the work in counseling centers is invisible, and so much of it is confidential and private, that most of the campus had no idea what we were dealing with. And when you hear some of the personal stories, they're much more of an impact than the data. I mean, you need the data to convince, administrators, but it's the personal stories they listen to be honest. And having a day-long conference allows you actually to go into more detailed examples of what students are facing. The other thing we did, actually with Temina's assistance, great assistance, was we were successful in writing for a SAMHSA grant. The first year those were available, a suicide prevention grant. And because she wrote most of it, we were successful. And we were thrilled. It was a 3-year grant. What that did is it allowed us to be visible on campus. It was a public information campaign on depression. And that raised our level of awareness, among faculty, among staff. We developed posters and bookmarks that had our name and our number. People somehow were alert to, oh, there's a campaign going on. Oh, yeah, that's where the counseling service is. It had a huge impact. The other things we did were system-wide. Besides each of our directors doing this on their campuses, system-wide, we made sure that there were presentations that we would go to the vice chancellors for student affairs when they met system-wide and talk with them about what was happening. We actually would go to system-wide conferences and make sure we got on the agenda presenting on the data we're seeing, the stories we're hearing, and the problems we're encountering. So it was a lot of information endlessly, probably for a couple of years, just raising awareness till people were tired of hearing it. The third set of actions we did was developing some new structures, and these I think were critical. We began a committee on our campus that many campuses have, a Chancellor's Advisory Committee on Student Mental Health. Now, not all of the campuses in the UC system had them. Berkeley started. Temina, again, was critical in helping us research this and look at, the 5 or 7 schools across the nation that had similar committees. And we were able to sell it. And that committee continues. It's a standing committee. It's evenly made up of faculty and administrators with student representatives and a couple of staff directors. But it's very heavily weighted on faculty and administrators, so that this committee every year makes a report to the chancellor on what's the status of student mental health and where are the gaps. In addition, we started a graduate student advisory group. And this is something that was kind of novel. I don't see on many campuses. At Berkeley, we have a third of our students are graduate students, about 10,000 graduate students. So we started a committee that basically would be representatives of the graduate division, faculty, administrators, and graduate students, who would meet with me and a couple of managers on my staff once a month to inform us of what are the mental health needs of graduate students and how can we address them better. In turn, they became our advocates with the Graduate Student Assembly, the Graduate Student Government, and with faculty on how to advocate for us. So it was a great partnership. We also have an undergraduate parallel to that, a Student Health Advisory Committee that has a mental health component. And as Temina went into detail, we started collecting a number of surveys, and those data were things that actually worked. I mean, we're dealing with academics. They listened to data. That had a huge impact. What didn't work, I'd say all along the way, different things don't work, and you need to be persistent. One of the speakers this morning said something like, I'm teachable or I'm trainable, but I may not understand it the first time. And so you need to train people again and again, and eventually they will get it. But don't expect to do one workshop or one presentation and assume that people are going to get it. Also, one of the things that didn't work is not all 10 campuses received equal proportional funding from the system-wide mental health fees. So each of the campuses got money to increase mental health. Some campuses were able to increase their staff of their counseling centers, some were not. And so the politics of an individual campus and how you connect with your administrators on your own campus will affect how well system-wide efforts will benefit your campus. So advice, third question I was asked, what advice do I have for counseling center directors who want to make these system-wide changes or in your own college, campus-wide? I guess the number one piece of advice that I would give is there really has to be a paradigm shift in how we do our work as mental health providers. We need to really look at advocacy for social justice and social justice for students with mental health concerns. Now, APA has developed, American Psychological Association, has developed guidelines for multicultural counseling, and it's just beginning to look at competencies in advocacy. The American Counseling Association has developed some full list of competencies in advocacy. And what's changing in our training programs, at least in psychology, is an awareness of social justice and how you need to train practitioners in getting beyond the individual counseling model and instead looking at how you as a practitioner need to be an advocate. You need to be an advocate in empowering your client to get what they're not getting. You need to be an advocate in the environment, in our case the campus, to make sure the campus is responding. And you need to be an advocate on a political and policy level to be able to go to Washington and to lobby senators and representatives. Vic's talk was just ideal in giving you a wonderful array of ways to do that. But becoming an advocate is something that's uncomfortable to many mental health providers. In the field of social work, it's more traditional. But most counseling centers have few social workers compared to psychologists or psychiatrists. And that's an area that really is shifting. So I'd say the one piece of advice that's most important is to really take seriously in your job, how are you helping your staff become advocates? How are you helping shift the work you do from doing therapy alone to doing therapy that's advocacy for social justice? A number of other pieces of advice I'll quickly give because I'm probably running out of time, is partner with your boss, if you're a counseling center director, with a higher administration. It's critical, if you're going to be an effective advocate, to have a supervisor and a vice chancellor who understands what you're doing and supports it, and who can take the message to a higher level in the administration, who can help give you feedback about what's being discussed at higher levels of administration so that you can say, well, that's a good opportunity to slip in a mental health agenda item. Another piece of advice I would suggest is focusing on faculty. So much of the work we do, often in suicide prevention in particular, focuses on students, and reasonably so, and how to help students. Often what gets lost is how critical faculty are in making decisions that affect policy on campus and therefore affect funding. Faculty typically, especially at a large university, understand the plight of graduate students, perhaps even more so than undergraduates. And so if you can work with your graduate students to work with faculty, I think you'll find it will go a lot faster than going through an undergraduate route. Maybe I'm cynical, but I believe you need to think of who are the decision makers, and the decision makers come from the faculty ranks typically, and they can influence policy not only in your campus but system-wide. Use your system-wide connections. If you're a counseling center director, certainly. If you're not in a system, use your other directors in your local area or in your group. A larger voice, a larger visibility will be more effective. Collect data, we've talked about. I really emphasize creating student advisory groups if you don't have them in your counseling center. Both for undergraduates and graduate students, they're very different issues for mental health for both groups. Don't clump them together. Listen to each constituency differently. And what the other two speakers mentioned also, I'll reiterate, is befriend the press. I sort of grew up in the counseling center work, learning I was supposed to hide from the press, because whenever I talked with them, they misquoted me. And then I would be embarrassed or called on the carpet. Did you really say that? And so I ended up kind of fearing them. But more and more, I've come to realize you need to really be friends with reporters, both in the student press as well as in the community, and be available to them when they call them right back. And you'll find that they will call you for ideas of topics, and it will give you a venue for actually getting press for things you want press for. And keep the message simple. Keep the message on it's a campus-wide or a system-wide issue, and therefore requires a campus-wide or a system-wide response. It's not just a counseling center responsibility. And finally, the last question we're asked to address is how do you sustain this work over time? And I guess I have two recommendations, maybe three. I guess the first would be we're at a time, we have been at a time in the last 5 years or more, where mental health on college campuses is in the spotlight. Be an opportunist. Take advantage of it. It's going to go away. Now is the time to build our programs. If you don't build them now, and if you don't advocate for them now, you've lost it. The second is to create campus structures that will endure. Create, if you don't have it, a president's or a chancellor's advisory committee on student mental health on your campus. Create student advisory groups. Create liaisons, if you're in a system, with the office of the president, with the administrative office for the system, and make sure you know someone there and meet with them regularly. And finally, and the most important, is building support for yourself personally. Doing advocacy is a very tiresome and a very lonely job sometimes. You need support from each other, and you need to build that in with your colleagues. So attending conferences like this is critical, where you get new ideas, but you also get nourished. So, thank you.
So I failed a little bit in my role as timekeeper, and that's because what they were saying I thought was compelling enough that it didn't seem right to shorten their talks. But we still have a few minutes for questions.
Tired audience.
Compelling enough that there's universal agreement with everything they said.
So can everybody hear me again? Okay. I will. The question is, and I'll rephrase it a little bit, California in 2004 passed what's called the Mental Health Services Act, Proposition 63, which is an act that dedicates money towards mental health services that need to be innovative and creative, meaning they can't, and the word that's typically used, the funds can't be used to supplant an already existing service. And your question was focused around its effect in the college environment, I think. And that's, excuse me for chuckling for a second. That is a very interesting question because we were talking about that, Jeff and I, over lunch. So in 2007, an initiative was passed under that act, and I'm holding a copy of it up here, and it's called the Student Mental Health Initiative. And the reason why I know about that is I was very intimately involved in it. And what the intention of that act is to provide funds for, it's both at the college, public college level, and for K through 12 programs. At the college level, it was broken out into 3 segments. Funds that would be used to help, and it's interesting off of some of the things we've been talking about, help faculty and staff in getting trained in the mental health area. A second section was on peer-to-peer support, and a third section was on suicide prevention. And that being obvious because of Mary and I having involvement with the act. The difficulty we're running into right now is it falls in under a category that's called statewide initiatives, and the act didn't clearly spell out statewide initiatives. And so there's been a lot of work that's gone on to try and get some of that, to try and get funding for it. Each county has to agree to allocate some money into a statewide fund. And without going into this in far more detail, because most of you, I don't think would benefit by it, that's happening gradually. And frankly, people like me are pushing to try and push the funding in it over the critical mass threshold to have it happen. So the simple answer, going to summarize, is we've directed some of the funds out of the California Mental Health Services Act to be college focused, but we haven't gotten to the point yet where those funds are clearly been designated and available. Are there other questions?
Okay, well, the panelists, I believe, will be up here for a few minutes after we're done, and we're going to start wrapping up the conference now. I'll say just a quick kind of wrap up of this session, and then invite John Graydon and Todd Sevig, co-chairs with me on organizing the conference, to wrap up. I guess this panel, for me, brought me back to, as many of the sessions in this conference have brought us back to Ralph Williams' initial talk and the question that he left us with about, do we care enough to make change? And I think clearly these 3 panelists care enough and then some. But for all the kind of technical things we've talked about with advocacy, I think in a lot of ways it does come down to that question, and we can draw inspiration from people like Jeff and Temina and Vic and Mary and others at this conference. I'd like to invite John Graydon and Todd Sevig up to help wrap up the conference.
Four o'clock. I've been here before. I'm going to be very brief, and I'm going to just focus on thanks. And the little comments that I was jotting down were in many ways done right before this. And then I listened to Vic, and I thought, my gosh, he's basically on the same page. And then to Temina, and then to Jeff, and I think that this was an excellent roadmap. So once more, I would really like to thank this last group. If we ask why we're here, I don't want to spend any time focusing on vision and plans. I think we know why we're all here, and I don't think we need repetitions of what we're trying to achieve. What I think I would just like to comment on is how to do that. Last night, the same comment, what is to be done? A Ralph Williams question at the end, his final rubric. We need voices. They need to be informed. They need to be passionate. Don't apologize for ever being passionate. You're very effective in that way. I think they also need to be an appropriate blend of science, data, evidence, and humanism. That's hard to achieve. It's why last night the group of us in the planning committee, largely driven by a suggestion from Bob Winfield, actually chose to invite Ralph Williams. I lost a little sleep on that. I was thinking, how would people receive this as part of a conference in the usual framework of what we do? And I've heard from many of you that it was something that was worth doing. And I think that's my viewpoint, at least. I'm not asking for affirmation now. So voices. We also need venues for those voices to get together. That's what led to this conference and many similar ones around the country. But that's not enough. Having voices on individual campuses, even having venues where they get together and share, is all still talk. Then what do? We need networks. And it's amazing. I looked around today, and I'm going to just give you a sampling. We have the NCDP, the NNDC, the National Network of Depression Centers, Welcome Back Veterans, a collection of 150 plus chapters of student veterans on campuses, SVA. We have the American Foundation for Suicide Prevention, Active Minds. There are just so many others that were coming here today, and they're great. What I think, in addition, that still isn't enough, in my judgment. In addition, we need collaborations now across those networks, because people bring different skill sets. And if we're to achieve the advocacy that's represented here and really make a difference taking it back to campus, it can't be done in isolation. And I, for example, really am a believer in the fact that what's going on with veterans right now, with a lot of political momentum behind it in a strange way, could actually benefit what we've been talking about on campuses. I think there is an overlap and a synergy there. And as we collaborate, I just have always been a believer that there's power in numbers and there's power in sharing. We need transparency in our own way. We just need to push out the findings and share them rather than being territorial and saying these are ours and we're running our program, and it just doesn't work if we're going to make this public health impact. And finally, what it all leads to when you bring a group of people like this together again is if we share these, we need to take it home. What we really need are actions. We need to just, these three panelists today laid out a roadmap, and it's a successful one for what's being done on some campuses. Campuses have different roadmaps, but take them home and use them. And sometimes I get in trouble when I use this. It's got an old legacy in military history. But for all of these things, a good plan executed now is better than a perfect plan executed next week. We just need to start doing these things and iteratively improving them. And what I heard in this last day and a half is a whole flurry of success stories. I was hearing a lot of accomplishments, and this is another of these. We're hearing them in various forms, and I think that it's wonderful. It's actually good. But I'm still struck by where I was last night when I was listening to Ralph. We just have so much yet to do. So the roadmap is there, and we have some stronger vehicles to drive right now. Now we just need to figure out how to pay for the gas. And that's actually where the advocacy messages come in. So this is, I think, a successful venue, exchange, collaborations, networks, partnerships, etc. And in order to make it happen, my only comment, also I would be remiss being the role that I play, is we need to really thank the planning committee members who participated, and especially Trish Meyer, who makes this possible. And I was going to say, I hope she's here to hear that, but she's in the back row. And most importantly, I think we need to thank those that we serve, because they're part of the Voices community right now. So I'd like to now just pass this back to Daniel and to Todd, those that also do the serving. So thank you, everybody, for coming, and we'll work with you next year.
John is the man. Just real brief from me. This has been just a wonderful conference. Seventh conference. Some of you have been here from day one. Others are new this year. Welcome, and have a great trip home. Just one thing from me. Part of my professional life has been spent in multicultural competency, social justice work. I appreciated Jeff's comments and the whole panel comment because the feeling is there. A roadmap to offer, and I was thinking about this sitting out there with my colleagues from the Counseling Center, but looking around the room at my Michigan colleagues in all kinds of settings, and I've talked with a number of you in different roles: parent, student, mental health professional, medical professional, faculty, academic staff, student affairs staff. My word, we're it. The gas, by the way, is cheaper than it was a couple months ago. So I think we can do this. My reference to the multicultural competency is there's a framework that was developed: knowledge, skills, awareness, and passion. One without the other, one by itself ain't going to do it. Let's pull it together in our different roles. And the last thing I would offer is let's also look within ourselves individually. We have to think at all kinds of levels. Let's start with ourselves as we leave. Let's think about what can I do after these 36 hours together around knowledge, skills, awareness, and passion to really create change.
So please feel free to send us your ideas for next year's conference. We will be back at it next year, and we hope to see you and bring some friends too. Have a safe trip back.